Hello, everyone. Thank you for joining today. Really happy that many of you have joined. So today we're going to do the second part of the medical ethics seminar. So yeah, we'll obviously this will branch off from what we discussed last week. And this will be our last session until early July, as the poll suggested. And yeah, because the exam season's like rolling closer and closer, so we've decided to take an organizational break to help all of the staff that work at ASN to take like a break and focus on their exams. But yeah, thank you very much for joining, and I hope that you find this seminar interesting. We'll start in about 2, 3 minutes just to let the last couple few people in. And until then, we'll just wait. Also, we have a lot of interactive scenarios in this as well, so it'd be really, really good if you can, interact in the chat like we did last week. The interaction was exceptional last week, so let's keep it at that because I'm sure it helped you build what you thought was useful as well, like your ethics. And like it just helps you as well. So make sure to interact in the chat and just do the best you can and learn from the other responses that other people give. Yeah, we'll just start in like 2 minutes. Thank you. All right, I think we can begin. I'll just do the very first part of the seminar today, just to talk about how you can use the seminar to the best of your ability and make sure that the time that you're spending attending the seminar is spent usefully. Can you move on to the next slide, please? Thank you. Yeah, so make sure to like take screenshots of any slides to refer back to them later because it will be quite content heavy. Or you can watch our seminar recordings on YouTube. I do have to post the last week's one, which I'll do after this seminar. But yeah, you will be able to find them by next week. Yeah, please, next slide. Yeah, so this session on ethics will help you form like the basic understanding of the common medical ethics principles that will help you prepare for your university entrance interviews. So, like a lot of your answers need to be based on these sort of scenarios because it is how healthcare in medicine actually works. Letitia, can you just not do that because I can't see the slides? Yeah, so it's just really, really helpful to help you prepare for your university entrance interviews and because they give you scenario-based questions And basing your answers off these ethical principles will really, really show that you're actually interested in medicine first. Second, that you already have like a primary understanding of what medicine and ethics of medicine requires of you. So it's really, really important. Um, and yeah, so the top tips is jot down some notes as we're talking. Make sure to take screenshots because I'm afraid we'll have to go a little fast to make sure we can fit everything in. And use your own perspectives of the situations that we will be talking about. So having an opinion about something and knowing how to explain it is very crucial for your interviews. But um, there is like a, like a sweet spot to it. You can't be too opinionated because at the end of the day, it's the medical ethics that will actually form your decision and not what you think. Be interactive in the chat, as I've said previously, because it can help you learn more about what other people have to say and can consolidate your own perspectives. So we have put question cues in our slides to help you form those perspectives. So please be proactive in the chat and just make sure you're making some notes. Next slide, please. So it's very important to form like an overall understanding of the medical principles that we will be talking about, because yeah, you're going to be given a scenario, and it's very really good to kind of base it on ethical principles and values that the NHS abides by, because it shows that you're kind of thinking like a medical professional already, and so yeah, that's why it's really really important. So you need to be able to give like a holistic view of the possibilities that can arise from the ethical principles you have considered to give like an overall perspective on what you need to be doing. Next slide, please. So yeah, how to actually structure your answers when you're in the interview. This might be really important to screenshot. So you need to first acknowledge the dilemma. I appreciate these are the slides we used last week, but there may be some people that didn't attend last week, so I'm going over them again. So acknowledge the dilemma. Start by showing you understand the conflict that is presented. So something you could say is like, this is a complex situation because it involves a conflict between, and then you need to identify key ethical principles, which we'll be going over in today's seminar and last week's seminar. So showing awareness of these ethical principles will help. So something you could say is that this involves like autonomy, as the patient has the right to choose, but also non-maleficence, as doctors must avoid harm. So explore both sides and do not be one-sided. You need to show like pros and cons for both, the patient and doctor's perspectives, the short and long-term impact. So those are some things you could be considering to kind of expand on your answer. So some connectives you should use are like on one hand, however, on the other hand, stuff like that. Next slide, please. And then continuing from that is consider the context. So bring in like real world factors, because it's all well and good to say, oh yeah, autonomy, should override something. But sometimes that's not the case because of real world factors. So like capacity and consent, which we'll be going over today. Patient safety, if the patient is, if their well-being is in risk, the medical professionals like knowledge and what they think is best may override their autonomy. Guidelines and professional like responsibility, multidisciplinary input as well is quite important, because the NHS kind of works as a team. Um, between different disciplines, different specialties. So it's very important to kind of think in like the real world context. So something you could say is in practice, doctors would also consider to kind of give that little edge to your answer. Giving a balanced argument is also very important, but you must conclude. So, but not like in this extreme way. So something you could say is overall, I think, but this would depend on, and obviously avoid like absolute answers or overconfidence, because you want to kind of explore both sides, but not come to like a very concrete conclusion. Just give like a conditional type of conclusion, if that makes sense. And end with a reflection. So ultimately, it highlights how important it is for doctors to balance patient autonomy with safety. So that's a good way you could kind of end your answer, but I think it's quite optional to do that. I think at the part where you're done with the conclusion, it should be good enough to kind of move on. Next slide, please. So key things that interviewers look for is balanced thinking like holistically, clear structure on how you're actually talking about things. So the structure that we provided you is pretty good. Calm reasoning as well. So you need to be able to kind of expand on what you've said. No extreme opinions and awareness of real world medicine and how ethical principles kind of play a real like role in the real world. Common mistakes to avoid is being too one-sided, as previously stated multiple times. Saying it depends without kind of explaining. You need to be able to explain really, really well. And ignoring like patient perspectives or a doctor's perspective. It can't just be completely medically centered, completely patient and emotionally centered. It needs to be a bit of both. Forgetting safety of the patient, of the doctor, of the medical staff is also quite something that is quite common. Trying to be over technical is a really big thing. You are not expected to know the ins and outs of how medical ethics works. You just need like a basic understanding. Maybe to dive in a little bit deeper, it's quite important to know like a little bit more, but you're not supposed to be like perfect in medical ethics, and you shouldn't really be knowing all the answers yet because that's what medical school is for. Next slide, please. And yeah, I'll hand over to Letitia now, who will be doing the majority of the seminar. But yeah, thank you very much for listening to my part, and I'll hand over now. Thank you.
Thank you, Serena. Hello, everyone. Good evening. I will be taking over for most of the remaining part of this seminar, where we will be talking about ethics to do with specific parts of medicine. So we will be starting off with the ethics of emerging technologies first. So the first kind of emerging technology that we will get an overview at first is artificial intelligence. Most of us, almost all of you, would have heard of what artificial intelligence is and of the different applications it has in medicine. Lately, though, artificial intelligence-based diagnostic tools are being used to predict the likelihood of developing various different kinds of diseases, and these could include diabetes as well as cancers. And it's being used in various surgical subspecialties like ophthalmology, which involves the eyes, cardiology for the heart, neurology for the brain, and for the spine. And it's also being used to analyze scans, medical images, because it can detect subtle patterns which might often go unnoticed by even medical professionals. And so it has a very high accuracy rate and can even reduce the chances of human errors which could occur. It can also analyze a large amount of data faster than any human could, whilst also being able to potentially reduce human error, overall just speed up the diagnostic process, and even, as we will go on later on, personalized care based on the patient's genetic profile. So based on the presence of certain biomarkers, it can even personalize treatment based on each unique individual. So far it has presented so many different advantages. It has been applied in so many different specialties and fields of medicine, but there are also certain ethical concerns with regards to AI that we will take a look at now. So we have already addressed the 4 pillars of medical ethics in the first seminar. So we will apply those pillars with respect to AI and see what different concerns we have. So when we talk about autonomy, which most of you already know is to do with the patient's ability to make their own decisions with informed consent, it is always important that we as medical professionals maintain informed consent with patients when it comes to, especially with AI, exposing highly sensitive patient data. And it's very important that this is made clear and transparent to the patient, especially because if this was done without the knowledge of the patient, this could impair the trust the patient has in the doctor as well as the ability of the doctor to make a diagnosis. Concerns have also been raised as to whether the complexities of AI could even overwhelm patients, since, of course, AI is not perfect. AI also has the chances of missing a particular detail, even making the wrong diagnosis, or even recommending the wrong treatment. And this might overwhelm or even burden patients even more. So it's really important that the use of AI alongside the expertise of the doctor is made very transparent to the patient and also has the patient's opinion involved. So overall, with autonomy, it's very important to have the informed consent of the patient first. So the patient should need to be made aware of every aspect of the use of AI. So the benefits that come with it, the risks that come with it, to ensure the patient fully consents to the use of AI. The second pillar is non-maleficence, which is doing no harm to the patient. Sometimes, in certain cases, the AI systems could be trained with data which is non-representative of the population, could maybe not verified, or could be low-quality research data. And as a result, as I mentioned earlier, this could lead to the wrong diagnosis or wrong treatment approach. And there is also a risk with the increased implementation of AI, the clinicians become overly reliant on the use of AI. And this is important that AI does not completely replace the expertise of the doctor, but is only used as something to enhance the diagnostic process. So it's very important that this use of AI is highly regulated, ensuring that the benefits it produces far outweighs any kinds of risks or consequences, so that this does not pose any kind of harm to the patient, since we would be using it to enhance patient care and not make it worse. Justice is, as we know, ensuring the equal access of healthcare resources to all patients, ensuring fair access to everybody. But the use of AI could actually further exacerbate and worsen these healthcare inequalities that are already existing. So, for example, hospitals which are found within highly developed areas, which are highly funded, could benefit from more of these AI diagnostic tools, whereas areas which are less funded, poor in terms of socioeconomics, or rural areas may not have enough of these funds to be able to implement these technologies, which would mean that there is a less access of this kind of technology to patients who are present in these areas, which is basically unequal access and goes against justice. The next kind of technology, you could say, that is also becoming increasingly implemented in medicine is personalized medicine, which is also to do with AI. Personalized medicine involves a laboratory analysis of a patient's genetic profile, so we can identify any kinds of mutations, changes in the genome, which are linked to inherited diseases with a genetic basis. Cancer risk could even be predicted. So, for example, a major form of cancer that is prevalent among women is breast cancer, and there are certain kinds of mutations associated with cancer risk which could be identified early on, even before a person develops cancer, or can even be used to predict the efficacy of a specific treatment. Genetic testing allows treatment plans to be specific to the patient's individual genetic profile. It could even help enable preventative interventions, so interventions that prevent the development or the progression of a disease, minimizing any kinds of adverse side effects, and overall improving the efficacy of the treatment. The clinicians, in order to recommend certain kinds of medicine before they perform this genetic testing, will first go through the history of the patient, so their medical history, history of diseases in their family, or their lifestyle history as well. How is this form of testing carried out? So we would use blood tests, biopsies, where we take a sample of tissue and analyze the sample, and molecular profiling in order to identify certain biomarkers present. And then based off of the results that we obtain, targeted therapies or specific drug programs can be selected that match the patient's genetic profile. Just for an example, breast cancer, for example, has certain kinds of receptors associated to it, which could be present in a certain breast cancer, but not in the others. So just as an example, we have ER, PR, and HER2. These are different kinds of biomarkers, which some people might be positive for, so they have it, but other women might not have it, so they would be negative for it. And even AI is actually increasingly being used to identify the presence of these biomarkers, and depending on whether the woman has those receptors or not, certain treatments would be recommended to people who have those receptors, and certain different treatments would be recommended for different patients who don't have those receptors. So this is kind of an example where personalized medicine is being applied. But once again, there are ethical concerns associated with genetic testing and personalized medicine. Firstly, we're talking about autonomy once again. We require the patient to be fully informed on the implications of learning about their genetic predispositions, because in some cases, patients may not want to know what kind of mutations they might have and what this could predispose them to. Maybe they might refuse to even get access to this information. So in those cases, it is really important that we as a doctor give the patient the full right to refuse getting that information if they feel that it would negatively impact them, since some patients might feel extreme distress if they were told that they have a mutation that could increase their likelihood of developing a certain disease. But this does not just impact the patient, but could also impact the patient's family, since concerns could be raised if the family members also found out that they had a risk of developing a genetic disease. This could even, for example, impact a family's choice to have children, since what if they were to find out they have the risk for the disease, there's always a risk they could pass on the disease to their children as well. So this could overall impact the well-being of some patients. So it's important that they get to refuse to access this information if they don't want to. Non-maleficence, once again, not doing harm to the patient. Personalized medicine, on one hand, can help patients take effective proactive steps in order to prevent disease, since through genetic testing, we can identify risks earlier, give interventions before the disease occurs, and it also enables professionals to personalize treatments depending on each individual patient's genetic makeup. But there are cases where genetic testing could lead to overdiagnosis, since sometimes patients, if they were identified to have a certain mutation, might be subject to overly invasive procedures, which would later be found out that they were not even necessary in the first place. So at the end of the day, invasive procedures are harmful to the patient. So this is one of the downsides of genetic testing. Justice is about fair rights and fair access to this kind of technology. But unfortunately, just like with the case of AI diagnostic tools, not all people would be able to get access to this technology, even if they needed it, because it's a very expensive procedure. And so it would be more exclusive to highly funded and highly developed regions, which could further, once again, worsen healthcare inequalities. Another kind of technology, not technology, but more of a procedure, you could say, is about experimental treatments and research ethics. Now, these are studies that are often involved in finding life-saving treatments and innovations that could possibly improve the efficacy of treatment or reduce side effects of a disease. And it is very important that we consult research ethics, that we establish a balance between protecting individuals from unknown harm, since most of these treatments, their side effects would not be known, but also fostering public trust in science misconduct by preventing mistreatments. So when carrying out experimental treatments, it is very vital that we get valid, informed consent from the participants, but at the same time, giving them the right to withdraw consent at any point during the study in case they do not wish to participate anymore. But how do we get this kind of valid, informed consent? We need to explain to the patient the purpose of the study, what the study aims to investigate, the risks and benefits associated with participating and taking the so-called treatment, the procedures that would be involved, any alternative treatments available, and also concerns associated with confidentiality. But what are the ethical concerns associated with experimental treatments? Firstly, once again, as with autonomy, very important to get valid, informed consent from the patient and the right to withdraw at any point during the procedure. Extra attention should be given to patients who might be vulnerable. So children, for example, who might not be able to give consent on their own. So a guardian would need to be consulted. Elderly patients or patients that have cognitive impairments, suffer with neurodegenerative disorders, for example, and thus they would not have the mental capacity to make decisions on their own. So we would need a legal guardian to provide consent, or else extra care should be put and invested into ensuring these participants understand what their role is in the study. Non-maleficence, of course, not doing any harm to the patient. It's vital that these treatments should have a clear, valuable goal. So either they improve the efficacy of a treatment or contribute to public health or to even reducing side effects. But the potential benefits of these treatments should outweigh the time, the effort, or even the risk that could be involved with patients being subjected to this treatment. Effort must also be put into minimizing any adverse side effects or risks as much as possible. So this could be physical, this could be mental, or even psychological adversity that could be caused as a result of participating in the study. So any kinds of harm should be minimized as much as possible. Justice, it should be made clear that patient selection should be fair and we must not exploit vulnerable populations. No certain group should be exposed to harm unfairly. So we should allow essentially ensure that people are fairly selected and no specific group is exploited. Justice also involves considering how the results of the study that we conduct can be implemented globally, and that these advancements, which are a result of these experimental procedures, should be accessible to anybody, regardless of socioeconomic factors, geographical factors, or any other factors besides clinical necessity. So there should be no discrimination made between who gets access to this kind of information. Now let us take a look at an interactive scenario. So before we move on to the next part of the seminar, we will have a scenario which, like we did last seminar, which was quite interactive, all of you can share your answers in the chat. So the first scenario, which is related to the emerging technologies, a hospital introduces an AI system to detect brain tumors. The AI misses a tumor, leading to delayed treatment and worse patient outcomes. Who is responsible for the harm that was caused here? So here are some prompts to help you make an answer. So who do you think should be held accountable? Is it the doctor who used the AI? Is it the hospital that introduced the system in the first place, or the developers who made the AI? Should we prioritize implementing technology, or do you think clinical judgment of the doctor matters more here? And should we prioritize the increased efficiency of the NHS that results from the implementation of AI, or does patient safety always have to come first? I'll give you guys 1 or 2 minutes to send your answers in the chat. We'll try to make this as quick as possible, and then we'll have a small discussion. So please share your answers in the chat while we wait. Yes, Anastasia has mentioned a good point here. So you're saying that it's either the doctors or the developers who should be held accountable for this error that has happened. You are right. Clinical judgment should always be placed as a priority. So as a doctor who has probably gone through scans like this multiple times before, it is important that the doctor first checks the scans themselves instead of letting the AI do the entire work. And so this, like you mentioned, it should be used more as a second opinion rather than letting the AI go through the scan on its own without the doctor using their expertise to go through it themselves first. And also, of course, the developers who clearly have made an error in the programming since the AI system was not able to detect a tumor. It is very important that they make the tool accurate first before allowing this kind of tool to be used in the hospital. So yes, that is a good point. We can wait a minute or so for any more answers, and then we'll move to the slide to see the points that you could consider. I think we'll just discuss the points then. So regarding accountability, as an answer mentioned, it is important to consider all the different people first rather than pointing out a specific person, because responsibility could even be shared among different entities. So each entity does have a role involved in this kind of error occurring. It's also important to consider certain public factors like maleficence, with doing no harm to the patient, and beneficence, and also holding not just accountable to the doctor, the hospital, the developers, but other factors that could have influenced this as well. Whether it's between clinical judgment or technology, it's important to consider whether doctors should rely solely on the outputs of AI, like Anastasia mentioned, or whether human judgment should always be the priority first before we rely on AI, and what are the limitations and advantages doctors can have. Because clinical judgment, although doctors would have years of experience, doctors do tend to also miss out something that the AI would have also done as well. Patient safety versus efficiency, since we do know AI does improve speed, it reduces the workload, it does still introduce risks, since missing a whole tumor would mean that the patient could go without a diagnosis, might not even receive treatment, and this tumor could have further progression before the patient even found out in the first place. So consider the stress that this could have on the NHS as well as on the patient safety. Now we're going to move on to the next part, which is resource allocation and organ transplantation, and discuss the ethics that are related to this. So the scarcity of resources that has been happening within the UK. So one of the things is to do with organ transplants. So there are far fewer organs that are available for patients than the patients who actually need them, along with ICU resources, which are also on a very big shortage, very limited, especially during crisis. And so there is this big margin between the number of patients that need them and the actual availability of these resources. So as a result, healthcare systems are forced to prioritize those who need care first and than those who could possibly wait a few weeks more in order to receive care. How are these kinds of decisions made on who receives care first? One basis is on urgency, so patients who are probably at imminent risk of death or patients who are progressively getting worse could be prioritized. Another thing is to do with benefits, so something to do with utilitarianism, which is seeing who has a greater benefit or which patient would have a maximized benefit in life later on if they were to receive the treatment. So, for example, certain patients have a greater chance of survival or a longer life expectancy, or might even have fewer complications if they were to receive the new organ. And the new organ could have a better impact on their lifestyle than it would on another patient who might possibly be have more complications, might be older, for example, so the surgery wouldn't have much of an impact on them than it would on a younger person, for example, or even to do with waiting time. So patients who have waited much longer would be prioritized first in order to ensure fairness, especially if their condition is getting worse. Decisions are usually made using scoring systems as well as with the aid of medical guidelines in order to reduce bias involved. And these are some key ethical principles that are also applied. So justice, as we already know, is a medical pillar, where resources should be distributed fairly to all patients without discrimination, whether the patient has more need or less need. So despite the condition of the patient, all patients should be given fair access to these resources. Utility is more of aiming to maximize the overall benefits. So like the concept of utilitarianism, where a patient who possibly the patient who, if a particular patient who received the transplant had a better in maybe had much more benefit in their lives compared to someone else who wouldn't receive as much benefit from the surgery. It is utility claims that it aims to maximize the benefit that is obtained. So maybe it saves the most lives or saves more life years. That patient would be prioritized. Equity is more about recognizing patients who need more support and prioritizing them first. So patients who are more disadvantaged or who have a more severe condition are prioritized. Equality, on the other hand, very similar to justice, is where everyone has an equal right to treatment. So as you may have noted here, equality and equity are quite clashing with each other, since equity aims to support patients who are more disadvantaged. Equality aims to support every patient regardless of their severity or background. And utility and equity kind of clash as well, since equity recognizes patients who need more support. Utility aims to maximize overall benefits, so it might favor patients who are possibly facing less complications or have a less severe version of the disease. These are some other ethical dilemmas involved. So to do with age, for example, young versus old, who would be prioritized? Is it the young or is it the old patient? Younger patients may have more potential life years ahead of them, but prioritizing them may be seen as unfair to older patients who might have more complications, for example. Younger people also have fewer chances of complications, but older people may have dependents who rely on them. Healthier versus sicker people. So this is also to do more with equity as well as utility. Healthier patients, according to utility, have greater benefit when it comes to them receiving surgery, but sicker patients, if we see this in terms of equity, are in need of more are in more need of this kind of surgery, are possibly facing more complications. And so to determine who requires a surgery first, triage is critical in these instances to determine who is in more severe condition. Lifestyle factors also play a crucial role, since, for instance, some believe that patients who have conditions that are related to smoking or to alcohol, so conditions that are lifestyle factors, shouldn't receive as much priority as someone who possibly has a genetic condition. But this also raises issues of fairness, since despite how the patient got the disease, every patient should still be able to access equal care. And this also goes against justice, since patients may not be looked at equally just because of they had a bad lifestyle. It's also important to consider that such factors are also a reason why patients need organ transplants and can also be argued as a public health issue rather than being something relevant to organ transplantation. So these dilemmas highlight the tension between getting fair access to healthcare and also looking at the outcome of if the patient were to receive that form of healthcare. So let's just get an overview of what we have seen so far. So organ transplantation and ICU care, as we have seen in the previous two slides, involve difficult ethical trade-offs. So there is a clash between a lot of different factors that are involved when it comes to deciding whether a patient should receive access to a particular form of care or not. And of course, no system is perfect. Every decision is not a yes or no decision, but more involves a compromise on all these different factors that we have seen so far. And all of these factors can still involve controversy. So we do use ethical frameworks as medical professionals to help guide our decisions, but they still cannot remove controversy associated with them, since, however, any way or the other, we would still compromise on one factor over the other. Doctors and healthcare professionals, though, fortunately, will be trained specifically for these kinds of decisions so that the system is made as fair as possible, but there are still ongoing debates and laws in order to ensure fairness and transparency. We have another in scenario here, so I'll give you about 1 minute or so just to make this quick to send your answers in the chat. So a patient is offered a new robotic surgical procedure with promising early success rates but unknown long-term risks. What factors should influence whether this treatment is offered? So you could refer to informed consent, innovation but at the cost of patient safety. What about patient vulnerability and about equity or justice and whether this widens disparities? So I'll give you a minute to send your answers in the chat. Yes, that is absolutely correct. Just like the first point says, informed consent, it's very important to explain to the patient that the doctor themselves are not aware of the risks associated. So they should try to provide as much information as they can about this kind of surgical procedure as much as possible, to ensure that even if they are not aware of the risks, the patient is still able to make an informed decision. Yes, that is absolutely right. It is important for the autonomy of the patient, so for them to make their own decision first, but also for the doctor to explain as much as they can of how much they are aware of the procedure and to be honest about the fact that they are not aware of the risks. Um, Yes, that is also right. It's very important to make sure whether the benefits would outweigh the potential risks, since the risks are not aware. There is an issue of posing harm to the patient, since there could be unnecessary risks associated. So yes, these are absolutely correct points. Let me just quickly go through some of the points which are just the same as what you have mentioned. So informed consent. Once again, how can the patient be able to understand the risks associated with treatments like these? Can you even consider consent valid if the patient is not even aware of the risks to do so? How much uncertainty can be accepted before we take the consent of the patient? What if the patient even decides to accept the risk just because they might feel there is no other option? So it is really important to weigh all these factors here, since sometimes in this situation, informed consent might not even consider valid, since the patient doesn't even have enough information to decide whether they would wish to proceed or not. And they might even feel coerced to accept it just because this might be the only option for them. And it's important to decide whether medicine is more about prioritizing treatments, new advances in technology, or whether it is more about patient safety and protecting patients from an outcome that might not even be certain. But it's also important to note that if we don't prioritize the safety of the patient, we won't be able to make new advancements in medicine. Another point to mention is about equity. Who will be able to get access to this kind of treatment? Since this is quite an advanced technology, would this only be found in highly funded regions? What about people who live in more geographically poor, geographically poorly in terms of socioeconomic factors? It's also, this would just worsen and exacerbate healthcare inequalities further within the UK and globally. So it's important to consider the guiding principles for this as well. The next part is to do more with the duty of candor and taking accountability. The duty of candor, as most of you might already know, is a statutory requirement set out for all healthcare professionals to follow. So according to the CQC, the Care Quality Commission, it requires all healthcare providers to be honest and transparent to the patients receiving care and treatment. So in any case of harm, it is important that honesty is prioritized and the patient is made aware of any form of harm that has occurred. So if a doctor has made a mistake with a surgery, for example, patients should be informed promptly and clearly about what has happened. A truthful explanation of events should be provided by the doctor. They could offer a verbal or written apology where appropriate and explain the next steps and investigations that should be performed. Additionally, it reflects the ethical principles of autonomy and non-maleficence, since patients are given awareness around the care they are receiving, and it also prevents harm since the doctor is being completely transparent to the patient. But of course, this is not as straightforward as it seems, since there are ethical tensions and issues involved. So doctors could often face a fear of being blamed, but there's also a need to be honest, since even if they adhere to this duty of candor, they may fear job loss, they may fear being taken action against, legal consequences for being negligent, damage to their reputation. So they might be unlikely to get jobs again in the future. This could create a conflict between the doctor trying to protect themselves and trying to hide the fact that they made this mistake, but the ethical duty of disclosing the fact that they have made a mistake. So this is a quite a severe ethical conflict, since professionals' instinct would be to first protect themselves, but as according to the duty of candor, they have an obligation to be open to the patient about any kind of harm that was caused. So this just highlights the fact that we need to implement a culture in healthcare where professionals can feel comfortable and safe enough to admit to their own mistakes without fearing punishment, without fearing being taken action against, whilst at the same time, of course, being held accountable for endangering patients and for posing harm, which is what non-maleficence is about, not doing any harm to the patient. When we talk about patient trust, in order to maintain trust with the patient, always being transparent to the patient is key. And when we follow the duty of candor, patients can feel respected, they feel informed about the care they receive, and they can further trust in the doctor. The NHS emphasizes openness as a core value for safe care. But when this duty of candor is not regarded and there's a lack of honesty and transparency from the medical professional, patients could often feel betrayed, deceived, ignored. They might lose confidence in the healthcare and the medical profession as a whole, along with losing trust in the healthcare system. And this is why it's essential that there is open communication between the doctor and the patient. So here is another kind of interactive scenario that we will do. So once again, just a minute to answer. A surgeon performs an operation and makes a small technical error during the procedure. The mistake has been corrected immediately and the patient recovers fully with no complications, and the patient is unaware that anything went wrong. So what are the factors that you think would influence whether the doctor should disclose this error to the patient or not? So please, around 1 minute or so, you can share your answers in the chat and then we'll discuss them briefly. That is a very good point that has been mentioned. Just because of the fact that it's important for openness and transparency and for the ability of the patient to trust the doctor, even if the error has not had any impact on the patient, it is still important the doctor makes aware of the patient that this kind has of mistake has happened and has been rectified so that the patient knows that the doctor is being transparent with them. This is also a good point of respecting the patient's autonomy, respecting the patient's ability to make their own decisions, and to be honest overall, just to be open and transparent so that the patient is made fully aware of everything that has happened. Exactly. Just like what has been mentioned before, it is important to have open communication. So, just to ensure that the patient has complete trust in the doctor, it is important that they make aware of any kind of errors that have happened during their procedure. Just like one of you mentioned, to respect the patient's autonomy, their decision to maybe not have not maybe change their surgeon. Maybe they would wish not to perform with the same surgeon again. So it could be dependent on the patient, but the patient should still be made aware of anything that has happened during their procedure, just so the patient can have the trust in the doctor, because if this was not done, this could reduce the trust the patient would have in the doctor. So open communication is essential. Some of the prompts, as we had seen, is more about being honest and having that trust. Is it about harm versus no harm? Is it still a duty to disclose what happened? Or is the fact that no harm had been done mean that it wouldn't have to be disclosed? And like most of you have mentioned, this could possibly reduce confidence in future care if it was not, maybe if the doctor were to reveal this, the patient might not have as much confidence in the doctor anymore. But once again, respecting the patient's autonomy is still crucial. But then the doctor might still fear blame, disciplinary action, or having facing legal consequences. So all of these, once again, could still influence the doctor's decision to disclose this kind of information to the patient. But once again, thank you so much for all of the answers. This is the last part for the ethics portion. So consent, capacity, and life-saving decisions. Most of what we've already seen so far. So consent, a very basic principle, is just a patient's clear agreement to receive a treatment after complete understanding of what it entails. Consent has to do a lot with autonomy because it protects the right to make decisions about their own body. But consent has to be informed, complete informed consent. So the patient should be given all the information regarding the treatment or the surgery that they're going to undergo. And this consent should be voluntary, so the patient shouldn't be forced into consenting. Rather, it should be consent from the patient alone. They shouldn't be coerced by anyone else, their family or anyone else shouldn't force them into maybe taking the treatment or the surgery. It should be completely voluntary and given by someone who has mental capacity. So someone who is a child, maybe, someone who is who has cognitive impairments, or someone who might be very old. So part of the vulnerable populations may not have the right mental capacity to decide this. So in that situation, it would be done by someone who has capacity. So a legal guardian or parents, for example. What makes consent valid? Well, this is just the same three factors that we have said. Capacity. The patient should be fully capable of making the decision by themselves, and this is dependent on a few criteria. So it could be on age and whether the patient has the mental capacity to make their own decisions. Understanding, so how informed is the patient? Are they aware completely of all the benefits, all the risks and alternatives available? And voluntariness, so if the patient has completely made the decision freely on their own behalf without pressure, without coercion into making this choice. If any of these factors are not met, the consent is not considered valid. So we want fully informed consent that has been made voluntarily by a patient who has the capacity to make this decision. What would we do in the case of a patient lacking capacity? As I said earlier, capacity is about a patient being able to understand, retain, weigh the information, to understand the information, and then decide their decision. If a patient cannot do this, decisions must be made in their best interests by someone who has the capacity. The Mental Capacity Act of 2005 guides this by stating that we have to always assume a patient has capacity unless it has been proven otherwise. Doctors should support patients in helping them make their own decisions and respect any decisions which may, even if not wise, should still be respected. It is important to act in the patient's best interests at all times. Which supports the fact that we're moving towards patient-centered medicine and choosing the least restrictive option. Now, this here comes in a bit of an ethical scenario. Even if a patient makes an unwise decision, if they have capacity, their decision should still be respected at all costs, even if it may result in death. Of course, if a patient does not have the capacity to make this decision, treatment should be given in their best interests from someone who has the capacity to make a decision in the best interests of the patient. So it could be a family member, for example. Here's a case study, for example, which is a quite common scenario that has been taken a look at. So, a patient refuses a blood transfusion due to religious beliefs. Should doctors prioritize saving the patient's life or respecting the choice? A competent patient, if the patient has a capacity to refuse the treatment, even if their decision could lead to death, the decision has to still be respected since the patient has the capacity to make their own decision. But of course, if capacity is lacking, once again, clinicians must act in the patient's best interest. So if the patient themselves, for example, they might be too young, they might be unconscious, for example, and in that case, it's not possible to get informed consent from the patient. Someone else who could act in the best interest of the patient could make the decision for the patient. Here is one last case study that we will take a look at before we move on to the well-being section. A 19-year-old patient is brought into A&E after a severe road traffic accident. They are conscious but in critical condition, and they need an urgent blood transfusion to survive. The patient clearly states that they refuse a transfusion due to religious beliefs, but they are in severe pain and distress. Their blood pressure is dropping rapidly. There is limited time to act. Their parents arrive shortly after and beg the doctors to proceed with treatment, insisting the patient is not thinking clearly. What factors should influence whether the doctors respect the patient's refusal or proceed with the treatment? The prompts are, is the patient displaying full capacity? Should we respect autonomy of the patient or doing good to the patient, curing the patient, beneficence? Is the refusal of the patient considered valid? And whether we respect the family's decision or what consider the fact that the patient is a legal adult and can make their own decisions. Please share your answers in the chat. I'll wait for 1 minute before we look at the points. Yes, actually, yeah. Jehovah's Witnesses are the specific kind of religious people who would actually refuse this kind of treatment. So that is actually a pretty good option to offer alternative methods since we would wish to act in the best interests of the patient who is old enough to make their own decisions, has the capacity to make their own decisions, but at the same time, it's important to act in beneficence as well, especially since the patient themselves are not exactly in the best state to think clearly and to be able to make a decision they might probably otherwise not make if they were completely were able to think clearly and to be conscious enough to make this decision. So it is a good idea to offer an alternative method which would balance out the patient's decision to not accept a blood transfusion, but at the same time acting to save the patient. So that is actually a very good answer. So I will now go through the points. So when we talk about capacity, we have to first weigh the fact if the patient is able to first understand, retain, and weigh the information. So the definition of capacity, is this definition being met? Since as we have seen, the patient is in severe pain, distress, they have low blood pressure. Could this possibly impact their ability to think clearly and to make a proper decision? Should we maybe reassess their capacity once the situation gets better? What about the validity for refusal, for example? Since they have refused to accept the treatment, it is important to consider that the consent must be informed, voluntary, and made with capacity, since clearly the patient has voluntarily given consent. We have to first determine if the patient has enough capacity. Secondly, are they informed? Are they aware about the risks and consequences of not receiving this kind of treatment? Or are they not voluntarily making this? Has someone coerced them into making this decision? Who gets the final say in this? Since the patient clearly is 19 years old, they are of legal age, their decision cannot override the patient, so their decision should be prioritized at all times. But sometimes emotional pressure from family can also influence clinical decisions. So, who exactly would be prioritized here? And another thing is about timing the critical decision making. Is it ever justified to act quickly in the patient's best interests without full certainty of whether this is really what the patient wants? And is it could you say that it is a responsibility of the doctor to preserve life, even if it goes against a patient's wishes? Where should the line be drawn? On one hand, we have autonomy, and on the other side, we have beneficence, which clearly are clashing against each other. These are some of the things that you can say to be considered, but of course, there is no one right decision to be made here. But a good answer that was mentioned in the chat is maybe suggesting alternative treatments that might um, be able to serve as a middle ground to allow the patient to receive treatment, but at the same time respecting their decision to not accept blood transfusions. Thank you, everybody, for taking part in the chat. It was really nice to read all of your answers. We will now quickly move on to the well-being presentation held by the well-being officers. Thank you, everyone.
Hello everyone, my name is Neha and today I am presenting on the topic of psychological safety and ethical decision making. I'll go through what it means, why it matters in healthcare ethics, and its link to the duty of candor. So first of all, what is psychological safety? Psychological safety is when individuals feel comfortable speaking up, asking questions, and raising concerns in a team setting. It also means admitting mistakes without the fear of being humiliated or punished. This allows for them to seek feedback, experiment with new approaches, as well as discuss errors, which is essential to help improve the care for patients. So, why does it matter for ethics? Psychological safety has been proven in studies to be important in diverse clinical settings across the world, especially when it comes to speaking up about errors and near misses earlier on. The lack of courage to speak up to point out or own errors in patient care can compromise patient safety, whereas feeling comfortable enough to speak up and prevent errors can lead to safe, high quality patient care. Despite how important speaking up is, there are several barriers in healthcare settings. One of the biggest is fear of blame or punishment, as staff may be worried about being judged, criticized, or even facing career consequences if they raise concerns. There is also hierarchy. Junior staff or students may feel uncomfortable challenging more senior colleagues, even if they notice something is wrong. Finally, workplace culture and pressure play a role. In busy environments, people may feel there isn't time to speak up or that their concerns won't be taken seriously. Together, these barriers can lead to silence, which increases the risk of errors and ethical issues going unaddressed. Please can you move on to the next slide? So the duty of candor is a professional and legal responsibility in healthcare. It requires staff to be open and honest with patients when something goes wrong, including explaining what happened and offering an apology. However, this relies heavily on psychological safety. If staff feel unsafe or fear consequences, they may avoid reporting mistakes or being fully transparent. So while duty of candor sets the expectation for honesty, psychological safety is what makes that honesty possible to practice. Without it, errors go unreported and opportunities to learn and improve patient care can be lost. So, finally, as aspiring surgeons and doctors, you don't have to wait until you're senior to promote psychological safety. It starts with small actions, like speaking up early, even as a student, and asking questions when something doesn't seem right. You can also challenge decisions respectfully, which is an important skill in ethical decision making. Another key role is supporting others. If a peer raises a concern, backing them up helps create a culture where speaking up is normal. It is also important to learn from mistakes rather than hide them, as this improves both personal learning and patient safety. Ultimately, psychological safety is built through everyday behaviors, and even small actions can contribute to a more open and ethical healthcare environment. Thank you.
Thank you very much, Neha and Latisha. That was very, very helpful, and also the link between the two were really good. But yeah, I've sent out the attendance form for this week. So make sure to fill it if you want the certificate. And other than that, the only thing else that we have to say is that this is going to be, as you may know, the last seminar until we kind of break off for the exam season, and then we'll get back to it with certain seminars as well. So like series of surgeries. So we will decide on what surgical specialty to look at, like we did with the neurosurgery seminars. But other than that, that is all we have. I hope you found this interesting and helpful, and maybe cleared some doubts about how ethics work in actual scenarios. And yeah, thank you very much for joining. See you next time.